Hello, I'm Cassie, and I have the pleasure of interviewing Dr. Michael Wald, who has been nicknamed the Blood Detective for his keen ability to zero in on health problems and find natural solutions. Dr. Wald has several degrees and certifications, including board certifications in nutrition. Dr. Wald, we're here today. We have some questions that people have sent us through. The first topic, autoimmune disease and low immunity.
Right.
So Mary is asking about her thyroid problem and lupus, and asks, I've been diagnosed with lupus and Hashimoto's thyroid disease. Can I do anything nutritionally for my problems? My doctor has put me on steroids and thyroid medication.
Okay, so Mary, I'm sure you're seeing very good doctors, and your health conditions, you're right, do involve your immune system. There's not a whole lot you're going to get in terms of nutrition from your medical doctor, so let me outline for you a couple of things that you might want to think about nutritionally and through improving your lifestyle. So let's take the Hashimoto's thyroiditis first. Hashimoto's thyroiditis is an autoimmune thyroid condition. It's the most popular problem of hypothyroid in the United States, which means that your immune system thinks that your thyroid gland is not your own. So the immune system reacts against the thyroid, it becomes inflamed, and a person develops sluggish thyroid function. So you can get everything from constipation to depression to increased heart disease risk, osteoporosis, all sorts of symptoms can arise from low thyroid. So some of the things that we would want to think about in terms of diet include, first of all, just cleaning up the diet, eliminating or reducing refined and processed carbohydrates in the diet, and all the simple sugars that are in desserty type foods, snacks, candies, and thinking more on a sort of vegetarian lifestyle. You don't have to become a vegetarian, but eating lower down on the food chain, meaning eating more fruits and vegetables and perhaps non-gluten grains. And if you are on thyroid medication, you may still also want to avoid what are called goitrogen foods. Those are vegetables such as broccoli, cabbage, and cauliflower, who have these elements called goitrogens that can slow the thyroid down even further. So those are some of the basic things you want to think about in terms of the Hashimoto's. And in terms of vitamin and nutritional supplements, it's best figured out through laboratory work and through questionnaires. But a few things to think about is vitamin D, which is required to reduce thyroid stress and inflammation. We also need vitamin D to actually make more thyroid hormone. And of course, just a basic multivitamin. And beyond that, really the laboratory work and sitting down with someone who is trained in clinical nutrition to figure out your particular needs, because not everyone with Hashimoto's needs the same nutrition and same diet. We can go on all day about that topic, but let's move to lupus as well, because Mary, you're someone that has two autoimmune diseases, and usually when we have one autoimmune disease, we're more susceptible to others, and with you, we've got two. So lupus, or systemic lupus erythematosus, is an autoimmune disease just like Hashimoto's, which means your immune system does not like certain parts of the body, and it breaks them down. And then, because of that breakdown, the immune system reacts even more and more. So it's a vicious cycle. So we've got the thyroid going on, and we've got virtually any other tissue in the body could be affected by the lupus. So the same types of dietary things that we just spoke about, cleaning up the diet, removing or reducing refined and processed carbohydrates, eating lower down on the food chain. Another benefit of that, by the way, again, eating more plant-based foods, it's just less inflammatory and much more friendly to the immune system. And in terms of nutritional supplements, just a few key ones for lupus include the hormone DHEA. That's not EPA, which is from fish oil. It's DHEA, dehydroepiandrosterone. That's made by the adrenal glands. It's usually very low or not optimal in lupus. And if you take more of that, particularly if the blood work is low, tissues rebuild better. They look more like normal tissues, and the immune system doesn't react against them as much. And then I just quickly mentioned fish oils or other forms or sources of omega-3 fatty acids, like from blue-green algae or perhaps flax oil, and then there is fish oil too. But for those vegetarians or people that want to reduce their intake of fish, then you go to the blue-green algae and the flax oil. But omega-3 fatty acids reduce immunity. They help modify a hyperactive immune system, which is what autoimmune disease is. We're always talking about low immunity, but these conditions, Mary, are too much of a good thing. So that's really the essentials to think about here, but it's really important to get the right laboratory work done to figure out what your particular nutritional needs are, Mary, because if you don't, you'll be taking things that sound okay on the surface, but may not be right for Mary's particular biochemistry. And that's essentially what there is to say on these particular immune diseases.
Okay, fantastic.
Okay.